Today, I have the honor of introducing to you Priscilla Clark will be our presenter today. Priscilla is a senior accountant with Myers & Stouffer, which is a certified public accounting firm specializing in federal and state Medicare and Medicaid programs for our webinar today. It makes it very, very interesting and very exciting because Myers & Stouffer are considered the premium group of folks who really understand all of the measures. And so I'm pleased today to present to you Priscilla Clark. So go ahead, Priscilla, and proceed.
Thanks so much, Connie and Christine. So today's webinar, we'll be discussing the patient electronic access objective for meaningful use. So the learning objectives for today is to know the patient electronic access requirements for the Medicaid Promoting Interoperability, or otherwise known as PI program. The second objective is to understand the differences in Objective 5, patient electronic access, between program year 2018 and program year 2019. The third objective is to learn about Arizona's patient electronic access documentation requirements. Objective 5. Is the eligible professional, EP, provides patients with timely electronic access to their health information and patient-specific education. This objective has two measures, and EP must satisfy both measures for this objective through a combination of meeting the thresholds and exclusions for each measure. We're going to go through a few definitions of terms that we will cover over the next few slides. Provide access means that a patient possesses all of the necessary information needed to view, download, or transmit their information. And then the slide continues to give a few examples of what that means. For view, the patient is accessing their health information online. For download, the movement of information from online to physical electronic media. Transmission, this may be by any means of electronic transmission according to any transport standard. Diagnostic test results, all data needed to diagnose and treat disease. So let's start with Objective 5, Measure 1. Measure 1 is for more than 80% of all unique patients seen by the EP. The patient is provided timely access to view online, download, and transmit his or her health information. And the provider ensures the patient's health information is available for the patient to access using any application of their choice that is configured to meet the technical specifications of the Application Programming Interface, or API, in the provider's Certified Electronic Health Records Technology, otherwise known as the Cert. So let's first discuss the changes from Modified Stage 2 in 2018 to Modified Stage 3, or to Stage 3. This measure was formerly Objective 8 in program year 2018. Now it is Objective 5. The threshold has increased from 50% to 80%. Starting in Stage 3, patient health information must be accessible via an API. So what is an Application Programming Interface? And we will call it API throughout this presentation. API is a set of programming protocols established for multiple purposes. APIs may be enabled by a provider or provider organization to provide patients with access to their health information through a third-party application, with more flexibility than is often found in many current patient portals. So what is the difference between an API and an app? An application or app is a software program designed for individuals to use on a mobile device. Apps are usually downloaded by a user to their smartphone or tablet. An API is a set of routines, protocols, and tools that governs how applications interact with other software programs or applications. For example, patient portals are often interfaced to the Cert via an API. An API connects the data from the app and the Cert. So we're going to walk through an illustration to explain how APIs work. In this scenario, on the right-hand side, we have a customer who is using an ATM to pull money out of the bank account. The customer represents the app user. The ATM represents the app or the user interface used when a patient accesses data in the healthcare world. The bank, to the left-hand side, represents the Cert, and the money represents the health data. In this scenario, the bank has all the money that the ATM needs access to, or the Cert has all the data that the app needs access to. The amount of money in the account determines what the customer can withdraw, similarly to how the health data in the app determines what the app user can access. In the bottom left-hand corner, you can see that the cord, the API, as shown in the picture, is the cord connecting the ATM to the bank. The cord represents the technology that sends the request for cash to the bank's database, verifies that there are enough funds in the account to withdraw, provides the permission from the bank to the ATM, and then communicates back to the bank how much was withdrawn. As you can see, that's a lot of things that the API does. It's the technology that sends your request to the bank's database and verifies that there are enough funds. If the cord or API is not connected to the ATM, it does not transfer the data. If the cord is not connected to the bank, the data is not transferable. Therefore, the cord or API must be plugged in on both sides, and the API must be turned on. And that API falls into measure 1, and so every EP needs to make sure that the API is turned on in their Cert. So CMS allowed some flexibility on API requirements. Originally, CMS intended to require EPs to first enable their API before or during the EP's reporting period. During the period was allowed only if the EPs could still exceed the 80% threshold. CMS also intended for patients to access their health information via an API within 48 hours of the information being available to the EP each and every time that information is generated. However, CMS made an exception. The word timely used in Objective 5, Measure 1 was unclear because it did not specify that the availability of data via the View, Download, or Transmit, or VDT, as well as an API, should be made available within 48 hours. CMS has clarified the wording for Program Year 2020, and the flexibility for this measure only applies to Program Year 2019. Under the Program Year 2019 CMS flexibility, an API no longer has to be enabled before or during the PI reporting period. The requirement to make patient health information, or PHI, available via API access within 48 hours is waived. EPs now just have to enable API by December 31st, 2019 for Program Year 2019. Please note that EPs still have to make patient health information available to patients via VDT within 48 hours, just not via API. EPs were required to do all of the following by December 31st, 2019. Enable an API that provides patients with API access to their health information. Provide patients seen during the EP's reporting period with instructions on how to authenticate their access through the API and information on available applications that leverage the API. The EP must maintain availability of the API. The API cannot be turned off for 1 day and then disabled. So as a result of the CMS flexibility, Arizona has become aware of the following Cert issues. Many EPs learned that API access was not enabled in their 2015 edition Cert, and many EPs were unable to exceed the 80% threshold for API access. Not all 2015 edition Certs were properly tracking whether API access was enabled. Some Certs were only tracking the data regarding VDT. For example, a Cert dashboard might show a percentage over 80%, but the dashboard is only tracking the VDT and does not consider whether an API was enabled. So we're going to go over the documentation requirements for Measure 1. We strongly recommend that every EP reviews his or her Cert dashboard, but now, so that each EP knows the following. What PI reporting period offers the best performance on all MU objectives, and what supporting documentation requirements the EP will need to meet upon attestation. There are 4 possible scenarios for EPs reporting on the Stage 3 Objective 5, Measure 1 in Program Year 2019. If the EP is unsure which scenario applies to them, reach out to Access for assistance. The following slides contain the documentation requirements for each of the possible 4 scenarios. And please keep in mind that this PowerPoint and any other documents referenced throughout it will be made available to the EP on Access website. So if you need to go back and check something as we start to get into each of the scenarios, this information will be made available to everyone. There are 4 scenarios to meet the API requirements. First scenario is API was enabled prior to the start of the PI reporting period, and the EP exceeds 80%. The second scenario is when the API was enabled during the PI reporting period, the Cert dashboard tracked API access, and the EP exceeds 80%. The third scenario is that the API was enabled during or after the PI reporting period, the Cert dashboard has a value less than 80%, and the Cert dashboard tracked API access. The fourth scenario is that API was enabled during or after the PI reporting period, and the Cert dashboard incorrectly shows a percentage above 80% threshold. Because the Cert dashboard is only tracking BDT and did not track API. If the EP does not fall into any of these scenarios, the EP has failed to meet the requirements of Objective 5, Measure 1. We recommend trying a different PI reporting period, but keep in mind that this may change which scenario the EP falls into, and hence the supporting documentation required. Please keep in mind that the inclusion of patients that opted out of the patient portal may change the scenario the EP is in. Further detail regarding opt-out patients is discussed later in this presentation. So here is an example of a decision tree to help you determine which scenario you fall into. We will discuss and show you how to use the decision tree later in this presentation. But basically, the decision tree will walk you through a list of questions, and you will follow along in the diagram to try to determine which scenario you fall into at the very bottom in the peach-colored oval. Okay, so let's determine which scenario the EP needs. If API was enabled during or after the PI reporting period, the EP needs to determine whether the Cert tracked API access. We are going to go through a test to help you to follow along with that you can use later on and go through to determine when API was turned on. To determine whether the Cert dashboard tracked API access, you'll conduct the following tests. The first step is to obtain the API enable date. If the EP does not know that, they can contact the Cert vendor to obtain this date. Step 2, review the Patient Electronic Access Measure 1 dashboard for any 90-day period that is entirely prior to the API enable date. So make sure in step 1 you get that API enable date before you move on in the test. So the test results for Measure 1. If the test results in the numerator equals 0, the Cert tracked both API and BDT, and the EP falls into either scenario 2 or 3 described on the previous slide. And this dashboard where you're pulling that numerator from, make sure that 90-day period in step 2 is completely prior to the API enable date. If the test results in the numerator is any number other than 0, the Cert tracked only BDT and the EP falls into scenario 4. There is a link here that takes you to a PDF that contains the decision tree. It contains the test we just walked through and what documentation is required in each scenario. And I will show you that PDF at the end of this presentation. So let's walk through an illustration of the test. Step 1, you obtain the API enable date. For our example, the API enable date is July 2nd, 2019. You may need to reach out to the vendor to receive that date. Step 2, you select any 90-day test period entirely prior to the API enable date. For our example, the test period is April 3rd, 2019 through July 1st, 2019, which is before the API enable date of July 2nd. Note that this period does not need to be the PI period, the EP intends on using for meaningful use. So let's walk through the test results of that percentage-based report that was pulled for April 3rd through July 1st, 2019. So say the EP had 5 patients who were provided timely access to view, download, transmit data during that test period. The numerator should be the number of unique patients who were provided timely access to view, download, transmit data, and their data was accessible through API. Looking at the percentage-based report pulled for 4/3 through July 2nd, and if that EP for the test results occurred, a test result of 0 in the numerator, that means the Cert was programmed to capture the view, download, transmit function for those 5 patients and was programmed to capture API accessibility, then the API was not enabled until July 2nd, which is after the end of the test period. The Cert accurately calculates a numerator of 0. If your percentage-based report shows test results of 5, which is greater than 0 in the numerator, that means the Cert was programmed to capture the view, download, transmit function and was not programmed to capture API accessibility. Since the API was not enabled until July 2nd, which is after the end of the test period, the Cert is inaccurately reporting a numerator of 5. So you will use this test to determine when your API was enabled and if your percentage-based report pulled from the Cert was tracking whether those patients had API access. So the standard documentation that will be required for all scenarios, and we're going to walk through these documents, but keep in mind that additional documentation may be required in addition to what is identified on this slide, depending on the scenario the EP is in. A Cert-generated dashboard for the selected PI reporting period should show the following: the provider's name, the numerator and denominator, and the measure percentage. Documentation supporting API was enabled must show the following: the API enabled date, the provider, practice, or location name, and documentation can be submitted in different formats. For example, a Cert screenshot with the enabled date and provider name on it, or a vendor letter confirming the date that API was enabled. The third type of document that must be submitted is a copy of instructions provided to patients on how to authenticate their access through the API. And the fourth document is a copy of information given to patients on available applications that leverage the API. Keep in mind, if the EP used the opt-out patient method to meet the measure threshold, additional supporting documentation is required. Further detail regarding opt-out patients is discussed later in the presentation. So let's discuss the documentation requirements for Scenario 1. The Scenario 1 definition is EPs who enabled API prior to the start of the reporting period and exceeds the 80% threshold. Those EPs need to submit the following documents: the standard documentation required as described on the previous slide. No additional documentation is needed for this scenario unless the EP is using the opt-out patient method. Scenario 2. The definition for it is EPs who enabled the API during the PI reporting period, the Cert dashboard tracked API access, and the EP exceeds 80% threshold. The EP falling into the scenario needs to submit the standard documentation, which was described on slide 22, and no additional documentation is needed for this scenario unless the EP is using the opt-out patient method. Scenario 3. Definition is that EPs who enabled the API during or after the PI reporting period, the Cert dashboard has a value less than 80%, and the Cert dashboard tracked API access. EP Cert dashboard may be misleading, and the EP may actually meet the measure even though that dashboard is showing less than 80%. This scenario creates a gap period between the start of the PI reporting period and the API enabled date, where the dashboard did not capture unique patients in the numerator. During that gap period, which is the start of the PI reporting period and the API enabled date, remember that part is where the gap period occurred. The inclusion of these missing patients may allow the EP to meet the minimum threshold because those patients were not being tracked in the percentage-based dashboard. EPs who fall into Scenario 3 must submit the following documents: the standard documentation as required and described on slide 22, a letter confirming that the EP added patient visits to the numerator to exceed the 80%, and a VDT and API audit log for the gap period. If API was enabled after the PI reporting period, the audit log must reflect only patients seen during the reporting period. If the EP used the opt-out patient method to meet the measure threshold, additional supporting documentation is required. Here's an example of what a VDT and API audit log can look like. The next slide explains what each column means and why it is required. Additional documentation to validate the accuracy of the audit log may be requested if selected for post-payment audit. For example, a copy of the email sent to patient ID 116 may be requested. The VDT and API audit log explanation. First, you needed to determine the gap period, which is the date between the start of the PI reporting period and the API access enable date. These patients who fall into this gap period make up the VDT and API audit log. Do not include patient visits that occurred after the PI reporting period. Do not include patient visits that were included in the numerator of the dashboard for Objective 5, Measure 1. The only patients in the VDT API audit log are those patients in the gap period because the Cert numerator is not calculating or including those patients in the dashboard. The service date column should include the date of the patient visit. The date VDT access provided column includes the date the patient was able to view, download, or transmit PHI, which should be within 48 hours of the service date. The date API documentation provided column includes the date the instruction to authenticate API and the list of available applications was sent to the patient. This can be provided via mass mailer, email, patient portal, or other means as long as this was done by December 31st, 2019. The last bullet is the formula that should be used to calculate the EP's real or otherwise known as attested numerator. It is the EPIP attested numerator, which equals Cert dashboard numerator plus the entries in the VDT and API audit log, and only if applicable, the entries in the opt-out patient audit log, which will be discussed later. So the revised calculation with that VDT API audit log. So let's walk through an example of what numbers could be included and how that works in the formula. At the very top, you can see there's the formula that was just explained in the previous slide. So for example, if the EP Cert dashboard numerator is 25, the denominator is 200, that gives the EP the resulting percentage of 12.5%, which is less than the 80% requirement. Entries in the VDT and API audit log equals 150 entries. Entries in the opt-out patient audit log is 10 entries. And those 10 entries, they are not required unless the EP chooses to add them to the formula. The EPIP newly attested numerator using the formula at the very top of the measure is 185. This includes the 25 patients from the dashboard, the 150 from the API VDT audit log, and the 10 patients from the opt-out patient audit log. The EPIP attested denominator for the measure is 200. The corrected percentage is 92.5%, which is above the 80% requirement. So originally in this scenario, the EP thought that they were failing the measure. And now, as you can see, using this formula, the EP is now meeting the 80% requirement. So moving to scenario 4. The definition for scenario 4 is that the API was enabled during or after the PI reporting period, and the Cert dashboard incorrectly shows a percentage above 80% threshold. Because the Cert dashboard is only tracking VDT and did not track API, the EP Cert dashboard may be misleading and the EP will not meet the measure without additional support. This scenario requires the EP to create an API audit log to demonstrate that patients in the numerator were provided with API access during the PI reporting period. The EP, to meet this scenario, needs to submit the following documents: the standard documentation required as described in slide 22, and an API audit log for the entire PI reporting period. As you can see, here is an example of what an audit log can look like. The next slide explains what the column means. The API audit log must include only patient visits that were included in the Cert dashboard numerator, where VDT access was provided within 48 hours of the patient visit. Additional documentation to validate the accuracy of the audit log may be requested if selected for post-payment audit. For example, a copy of the email sent to patient ID 116. Okay, so let's go over what each of those columns potentially could mean. In general, the API audit log should include patient visits that occurred during the PI reporting period. Do not include patient visits that occurred after the PI reporting period. Only include patient visits that were included in the numerator of the dashboard for Objective 5, Measure 1. The service date column should include the date of the patient visit. In the VDT access provided column, mark with a yes to confirm that the patient had access to VDT patient health information within 48 hours. If VDT was not met, you need to mark that patient as no in that column. The date API documentation provided column includes the date instructions to authenticate API in the list of available applications was sent to the patient. This can be provided via a mass mailer, emails, patient portal, or other means as long as this was done by December 31st, 2019. The formula in the last bullet point should be used to calculate the EP's real or otherwise known as attested EPIP numerator. That equals the entries in the API audit log plus the entries in the opt-out patient audit log if applicable. So providers do not have to include the opt-out patients unless they want to. And so if using the opt-out patient method, track these patients via an opt-out patient audit log. Do not include them in the API audit log because that results in double counting. Additional details regarding opt-out patient method is discussed later in this presentation. Okay, so let's walk through a calculation scenario for 4 regarding the API audit log. So you can see the formula at the very top. And then the example is that the EP Cert dashboard numerator showed 175, the denominator showed 200. The resulting percentage is 87.5%, which is above the 80% requirement. An EP looking at their percentage-based dashboard may automatically think that they meet the requirements for Measure 1. However, keep in mind that for Scenario 4, the dashboard is not tracking the patients who had access to API. Therefore, those numbers are not accurate to help the EP meet the requirements. So then the EP has to create an API audit log. So let's say if there was 160 patients in that API audit log. There was 10 patients in the opt-out patient audit log. Combining all of those numbers, you would have the resulting number of 170. The numerator, as you can see, decreased because the Cert dashboard did not account for whether access was available via API. The denominator is 200, and the resulting threshold is 85%. The EP still meets the requirements. The EP must go through this calculation to ensure that their numerator does not increase to a significant lower number that causes them to fall beneath the 80% threshold. Here's another example to help y'all understand what scenario each EP may fall into. So as you can see, the reporting period is September 23rd, 2019 to December 21st, 2019. We're going to go through Scenario 1 first. As you can see, the pink arrow all the way to the left in the calendar month for September shows that the API was enabled before the start of the reporting period. If an EP falls into that scenario, they're in Scenario 1. For Scenario 2, you want to look for the yellow arrow, which is in the month of October. And it's in the grayed out area. That grayed out area is the reporting period. It's showing that the API was enabled during the reporting period. So if the EP meets that the API was enabled during the reporting period, and the EP exceeds 80%, and the EHR tracked API, then the EP falls into scenario 2. Now let's move to scenario 3. As you can see, there are 2 black arrows, okay? So you just want to look at one or the other. This is just showing 2 examples of what could occur. So we'll look at the black arrow that is in October calendar. That shows that the API was enabled during the reporting period. EPs that fall into scenario 3, their API can be turned on during or after the reporting period, okay? So right now we're just talking about if the API was enabled during the reporting period, you would look for that black arrow. The EP must also have the dashboard at less than or equal to 80%, and the EHR was tracking API. Then this EP falls into scenario 3. Now using that second black arrow, that shows the API was enabled after the reporting period, and if the EP is at less than or equal to 80% and the EHR tracked API, that EP falls into scenario 3. Moving to scenario 4, it's going to be a blue arrow. As you can see, EPs that fall into scenario 4, their API can be enabled during or after the reporting period. Let's look at that first blue arrow, which is in the December calendar in the gray area. It shows that the API was enabled during the reporting period, and if the EP's dashboard incorrectly shows at or above 80% threshold, and the EHR only tracked BDT and did not track API, the EP falls into scenario 4. Now looking at that second blue arrow, which is not in the grayed out area, it shows that the API was enabled after the reporting period, if the EP dashboard incorrectly shows at or above 80% threshold, and EHR only tracked BDT and did not track API, the EP falls into scenario 4. If this helps you understand the scenarios, go ahead and use it. We're going to walk through that decision tree again at the very end, which is another way you can try to understand which scenario the EP falls into, because it's very complicated getting to which scenario. Definitely as you move to scenario 3 and 4. Here is just a broad overview slide of all the different formulas. You need to make sure you use these formulas when you're testing an EPIP, because that numerator, the recalculated numerator, is what you will use to show and support that you meet the minimum threshold. As you can see, the last pieces of each formula talk about the opt-out patient audit log. That is not required. Only if the EP chooses to include opt-out patients will that opt-out patient audit log and those numbers be included in the formula. Okay, so that covers Objective 5, Measure 1. We'll now be moving on to Objective 5, Measure 2, and at the very end of this presentation, we will be talking about Objective 5, Measure 1 a little bit more. So, Measure 2, the EP must use clinically relevant information from Cert to identify patient-specific educational resources and provide electronic access to those materials to more than 35% of unique patients seen by the EP during the PI reporting period. Some changes from modified stage 2 to stage 3, as you can see in the first bullet point. It was originally Objective 6, now Objective 5, Measure 2 in stage 3. The threshold increased from 10% to 35%, and paper-based actions are no longer allowed to be counted. EPs may still provide paper-based educational materials, but they may no longer be included in the measure calculation. Documentation requirements for Measure 2. The EP must provide a Cert-generated dashboard for the selected PI reporting period that shows the following: the provider's name, numerator and denominator, and measure percentage. If the EP used the opt-out patient method to meet the measure threshold, additional supporting documentation is required. Further detail regarding opt-out patients is on the next slide. So opt-out patients. This does apply to Measure 1 and Measure 2. CMS allows EPs to include a patient in the numerator of Objective 5, Measure 1 and Measure 2 if the patient elects to opt out of electronically accessing their health information. The patient must still be included in the denominator. An EP may count that patient in the numerator if the patient has provided all of the necessary information to subsequently access their information, obtain access through a patient-authorized representative, or otherwise opt back in without further follow-up action required by the EP. So the documentation requirements. Let's go through and talk about what would be required if an EP includes the opt-out patient. You create an opt-out patient audit log, including the patient name or identifier and the date of cert. Do not include patients in the opt-out patient audit log that are already included in the numerator of the cert dashboard, the VDT and API audit log, or the API audit log. For Measure 1, the EP must provide API documentation to all patients who opt out of seeing their PHI. If the API documentation is provided via a patient portal, the EP must separately provide it to all opt-out patients via another means because patients will not be able to view the documentation in the portal. Please retain documentation supporting the opt-out patient audit log. Documentation must demonstrate the patient willingly chose to opt out. For example, a signed document stating the patient opts out, or the patient provided all the necessary information but did not log in the patient portal. This is an example of what a patient audit log looks like. The opt-out patient audit log must include only patients that had a visit during the PI reporting period. Additional documentation to validate the accuracy of the audit log may be requested if selected for post-payment audit. For example, a copy of the document the patient signed stating they opt out. Please keep in mind that if you're not including opt-out patients in Measure 1 or 2, then it is not necessary to keep an opt-out patient audit log. But if you do include them for either measure, then you need to document this audit log. Moving to Objective 5, exclusions. These exclusions apply to Measure 1 and 2. An EP may take an exclusion for either measure or both if either of the following apply. The EP has no office visits during the PI reporting period, or the second exclusion is the EP conducts 50% or more of his or her patient encounters in a county that does not have 50% or more of its housing units with 4 megabytes per second broadband availability according to the latest information available from the Federal Communications Commission on the first day of the PI reporting period. Exclusions for this objective are the same as exclusions in Program Year 2018 Modified Stage 2. Let's discuss the broadband access exclusion. For program years 2015 through 2017, CMS identified the counties in the U.S. who conducted 50% or more patient encounters in a county where 50% or more of its housing units do not have 4 megabytes per second broadband availability and therefore meet the broadband exclusion. The state of Arizona does not have any counties listed, therefore an EP in Arizona is not able to meet this exclusion. CMS has not published an updated list of the counties. However, the majority of counties in the U.S. have increased their broadband availability and still do not meet the requirements for the exclusion. It is unlikely the broadband availability would have decreased since the CMS tip sheet was published. The link at the bottom of the screen does take you to that tip sheet if you want to review it after this presentation. The documentation requirements for exclusion. If the EP takes the exclusion that the EP has no office visits during the PI reporting period, they must submit documentation supporting that all patients seen by the EP are conducted outside the office. This is a very hard exclusion to meet, so make sure if you are taking it that you do meet and contain the necessary documentation to support it. Broadband access exclusion, sufficient documentation, the EP must show that they conducted 50% or more of the patient encounters in the eligible county. The county shows that 50% or more of its housing units do not have 4 megabytes per second broadband availability on the first day of the PI reporting period. Let's discuss a few audit findings. So what happens during an audit? All providers that receive a Medicaid PI incentive payment could potentially be selected by Access for post-payment audit. If selected, Access post-payment analysts will conduct a thorough review of the documentation attached to the EP's attestation and EPIP to determine if it meets the program requirements. Please keep in mind that additional documentation may be requested to validate the accuracy of each of the 3 audit log types. Access may follow up with additional questions or documentation requests. Some common audit findings is that the Cert dashboard does not show the PI reporting period or EP name on it. Failure to maintain documentation and practice no longer has access to the Cert. Supporting documentation does not have appropriate dates. including data for the entire practice in the reported Cert report rather than data for the individual EP, or another common audit finding is not uploading the Cert dashboard during attestation. Now, before I go over the resources, I know that was a lot of information to give to y'all. So I want to give y'all just 5 big takeaways from this presentation, and please keep in mind that we'll answer questions at the end of this presentation, and this PowerPoint and the documents I'm about to go over will also be made available to y'all through the Access website and Health Current. So the first big takeaway is an EP needs to start on slide 19 and conduct the test to determine when their API was enabled and whether the Cert was tracking API. Some EPs may fall into scenario 1 or 2, which does not require as many documents. So make sure you go and find out when your API was enabled and whether the Cert was tracking API. The second big takeaway is after determining the outcome of that test, which was on slide 19, use the decision tree, which we're about to go over, to determine which scenario you fall in. The decision tree is also on slide 18. Takeaway 3 is that the EP needs to use the appropriate formula on slide 34 to calculate the correct EP numerator for Objective 5, Measure 1, to make sure the EP is meeting that minimum threshold. For number 4, make sure to collect the document that is required for the scenario you fall into. Slide 22 shows the standard documentation that every EP should have. Plus, if you fall into scenario 3 or 4, make sure you have those required documents. Number 5, the opt-out patients discussed on slides 39 through 41 can be used for both measures if appropriate actions are taken to support those opt-out patients. So those are the 5 big takeaways. You can go through this PowerPoint later, reach out to Access with questions if you don't have it at the end of this webinar. We're going to go over some of the resources that we used to put together this presentation was the CMS Objective 5 tip sheet, the CMS Broadband Access Exclusion, and the final rule for modified Stage 2 and Stage 3. If you click on these links, they will take you to those documents to look at. While we have a few minutes left, what I'm going to show y'all is the bottom link, which is Patient Electronic Access and API Documentation Requirements. So I'm going to bring up the PDF, which contains those documents, and we're going to go over the decision tree. Okay, give me just a minute to pull this up. So that decision tree that we discussed earlier, which was when was the API enabled in the Cert. Give me just a moment to switch over from the PowerPoint to the PDF. Okay, so you should be seeing the PDF that we will discuss. So first we're going to go over the test. So the first test, this PDF is going to show you what different tests, the tests that you can determine to show that API was enabled. This information is on the PowerPoint as well as in this PDF to help you. So if API was enabled during or after the PI EHR reporting period, the EP needs to determine whether the Cert tracked API access. And it goes through step 1, step 2. It talks about the test results for measure 1, if it equals less than 0, or if the test results are something other than 0, so greater than 0, which shows that the Cert tracked only VDT. It walks through the example of it. And so the same example that was on the PowerPoint, you will also be able to see here. So that's on page 2 of the PDF that will be made available to you. Starting on page 3 is the scenario. So you can go through and look at what documentation requirements are there. Okay, and so it lists by bullet, each bullet at the bottom of each page in red shows the formula that you will be using. We will also look at on page 1, which is the most important and that you should be looking at when reviewing different documents. it has this decision tree that is going to help you. And I will zoom in so that you can see it more clearly. So at the very top, it asks, when was the API enabled in the cert? And there's lines going from that blue triangle at the top. And it goes to each circle. There's the circle that shows before the PI reporting period, it shows during the PI reporting period, and then all the way to the right, it shows after the PI reporting period. So depending on where your EP falls, that's the route you're going to follow. So let's say, for example, we're dealing with EP, and it's before, the API was enabled before the PI reporting period. It's still going to ask you a few questions, okay? Right here in the gray area, it says, does the dashboard exceed the 80% threshold? If yes, right here in the peach color, it says EP in scenario 1, see page 3. So this is on the first page of that PDF that I just showed you the test results for and the documentation requirements. So then you're going to go to page 3, and it's going to show you what documents you should be keeping and submitting during attestation. However, if it's no, the dashboard does not exceed 80% threshold, the EP fails. We recommend that you select a different PI period to try and help the EP meet the requirements. So going back to the top, when was the API enabled in the cert? So we're going to go through another example. Say the API was enabled during the PI reporting period. Then you go to the next question. Did the dashboard track API access? So once you determine that, and you can use the test results on page 2 to determine that. If it's yes, you'll move to this other question. Does the dashboard exceed the 80% threshold? If yes, the EP is in scenario 2. And it says, see page 4. Okay, so you can go straight there and determine what documents you need to keep in order to support your answer. If the dashboard did not track the threshold, then you're going to go down the other arrow, which is no. And the EP is in scenario 3, which means you're going to see page 5 of the document. Going all the way back up, right here, did the dashboard track API access? If no, then you're going to ask the question, does the EP dashboard exceed the 80% threshold? If yes, that EP is in scenario 4, and you will look at page 6 to determine what documents are required. But if the dashboard did not exceed the 80% threshold, you are supposed to follow the arrow to the right, which shows the EP failed, and that the EP should select a different PI reporting period. Okay? Now, if you're stumped or you have questions about where you are at, and maybe one of the questions you're not sure what to answer, please feel free to reach out to Access to help make sure that you know which scenario you're in when you start the attestation process. So if the API was enabled in the cert after the PI period, then that means you're all the way to the right. And we'll scroll down. Did the dashboard track API access? If yes, then you're going to go to the next question. Does the dashboard exceed the 80% threshold? If that's a yes, you come to this thing that's going to stop you. It says not possible. Confirm answers to questions above are correct, because this is not a possible scenario to follow in, because if the dashboard tracks the API access, and then it shows that the dashboard exceeds the 80% threshold, that is not possible because if you scroll to the top, you're in the period where API was turned on after the reporting period. So your dashboard should not be showing above 80%. So make sure you go back there and answer those questions. And if you still come back to this result again, feel free to reach out to Access to help make sure that you're answering those questions correctly. So going back to that question, does the dashboard exceed 80% threshold? If no, the EP is in scenario 3, and you'll look at page 5 to determine what documents are required. Okay? Now back to, did the dashboard track API access? If no, you're going to ask the question, does the EP dashboard exceed 80% threshold? If yes, that means the EP is in scenario 4, and you're going to look at page 6 for what documents should be submitted. Going back, if the dashboard does not exceed 80% threshold, the EP fails, and we suggest that the EP try selecting a different PI reporting period. So this decision tree, if this is what's helpful to help you understand what decision the EP falls into, please, by all means, use it. If it doesn't, there's the calendars that we showed you, the example of where the EP falls into, which scenario, whatever helps you the best to understand this scenario and this measure. We're going to open up the line for questions. in case anybody has them. So I'll hand this back to Connie to read off any questions that may be asked.
Hi, Priscilla, it's Christine. I will open up all lines. Folks are welcome to use the chat box as well, or feel free to ask your questions to Priscilla as we get the lines open. Let's see here. I think I have unmuted just about everyone. If you don't have a question, please keep your line muted so we don't get additional feedback here. But if you do have questions for Priscilla on today's presentation, again, the chat box is open, or you are welcome to ask them on the conference call.
While we're waiting for any additional questions to come in, I want to add one more thing, that there is a file for frequently asked questions, which I will bring up as well. And it lists just some questions that you may have, that you may want to ask. So please look into this FAQ to see if those questions are something you have before reaching out to Access.
Priscilla, you've done a great job. They're all now knowing all there is to know about today's webinar, but we will still continue to leave the lines open should a question come through. At this time, there is nothing in the chat box, but again, we'll pause and let folks take a few minutes if they're formulating those questions for you.
Since we have a few minutes before the webinar ends, until there's some questions, so Connie and Christine, please interrupt me if there's another question, because I want to answer everyone's questions on this call. But I'm going to go through some of these questions and answers that I think are more important. We don't have enough time to go through all of them, so I'm going to just find some ones that I think could be key to maybe potentially help guiding everyone to understanding this complicated measure. So that's question 10. Does API access have to be available to the patient within 48 hours of the patient visit? No, it does not for Program Year 2019. An EP does not have to ensure that PHI is available to the patient via API within 48 hours. However, an EP must ensure that PHI was available via API by December 31st, 2019. EPs are required to do all of the following by December 31st, 2019 to meet the API requirements. They must enable an API that provides patients with API access to their health information. They must provide patients seen during the PI reporting period with the two following documents: instructions on how to authenticate their access through an API and information on available applications that leverage the API. And they must maintain availability of the API. The API cannot be turned on for one day and then fixed. The next question kind of outlines the scenarios, again, gives the definitions for those scenarios, and then it also references the tip sheet that we just discussed for API documentation requirements, which has the decision tree on page 1. So as you can see right here, it's referencing footnote A. And if you scroll to the bottom of that, you should see the link that takes you to the API documentation requirements for Program Year 2019 and that decision tree. Okay, question 14, what is a gap period? And this is for patients or EPs that fall into scenario 3. A gap period is a period of time between the start of the PI reporting period and the API enabled date. If the Cert dashboard was tracking API access, it will not capture patients in the numerator during the gap period where API had not yet been enabled. Therefore, a VDT and API audit log may be necessary to add those patients to the numerator if the provider is not meeting the 80% threshold in the Cert dashboard. And then question 15, which I think is extremely important for EPs who are falling into scenario 3 or 4. Why is an EP only required to create an API audit log for scenario 4 instead of a VDT and API audit log for scenario 3? The answer is that the CERT dashboard tracks VDT in both scenarios. However, in scenario 4, the CERT dashboard numerator only supports the numerator of patients who had VDT access but not API. Therefore, an EP in scenario 4 needs to provide an API audit log identifying every patient in the numerator of the CERT dashboard and confirm whether the patient was provided with API documentation during calendar year 2019. In scenario 3, the numerator in the CERT dashboard supports the patients who had both VDT and API access between the date API is enabled and the end of the PI reporting period. The CERT dashboard is most likely not counting the patients between the start of the PI reporting period and the date API is enabled. For the EP to meet the threshold, the EP must use the VDT and API audit log to track the patient's seen between the start of the PI reporting period and API access enable date. Okay, who is an opt-out patient? The answer is a patient who elects to opt out of electronically accessing their health information. And again, I know a lot of this can be overwhelming. There was a lot of information given out to y'all. Please keep in mind that all of these documents will be made available by Access and Health Current. If you have any questions, feel free to reach out to try to understand it. You may need to take some time and reread it and go through it. I highly recommend that the first step you do is figure out when that API enabled date was and figure out if the CERT tracked API. So go back to that decision tree, go back to the test result, and figure out first when the date of the API was enabled and if the CERT is tracking. Okay. So for a patient to be included as an opt-out patient in the EP's numerator, how many times must the EP reach out to the patient, inviting them to view, download, and transmit, or use an API to access their PHI? The answer is the EP only needs to provide all the necessary information once during each visit. The necessary information should provide information to the patient to subsequently access their information, obtain access through a patient-authorized representative, or otherwise opt back in without further follow-up action required by the EP. If the EP does not provide all the necessary information during the first contact, the EP will need to reach out again to ensure that all necessary information is provided to the opt-out patient. The EP may need to reach out to the patient a second time if the API documentation is provided via a patient portal. The EP must separately provide it to all opt-out patients via another means because patients will not be able to view the documentation in the portal. A patient who has multiple encounters during the PI reporting period or even in subsequent PI reporting periods in future years needs to be provided access for each encounter where they, the patient, are seen by the EP. And I think that is all the questions I'm going to read out aloud. Are there any remaining questions out there that y'all want answered?
Hi, Priscilla. It's Christine again. We have not received any in the chat box. All lines do remain open. If folks are on the call today and would like to have Priscilla answer a question directly, we're happy to take those at this time. Priscilla, I'm not getting any additional questions. Maybe folks would like to send them via email to you. Do you have your slide up at the end for any questions or answers, or the email folks can send questions electronically to? I know you can send them directly to Health Current at ehr@healthcurrent.org. or to the Access website email directly. Oh, I do have a question. Do you have an example where the patient opts out and how, other than the patient portal, can they access their data electronically? Well, I'll read that again. Do you have an example where the patient opts out and how, other than a patient portal, can they access their data electronically?
That patient, since they opted out, that means they do not have potentially access to their patient portal. They should be able to opt back in. The requirement is for opt-out patients when they opt out that they do not, and so they don't have access to their patient portal at that time.
Thank you, Priscilla. Any other questions via the chat box? Or again, all lines are open for Priscilla to answer those questions.
And just to clarify that question, is that my answer, I just want to add a few more things, is that the opt-out patient, even though they may not be looking at their patient data in the patient portal, they should have other options to access that data outside of the patient portal.
And that's my question. How?
Okay. So for apps and everything, so for API, that allows them to have access through apps. And so an EP, when they turn on their API, they enable it. That means that patient data should be accessible through apps and other methods. And that's part of the...
So that's part of our patient portal, Priscilla. I'm confused. They're either on the patient portal or they're not. So they have access to their patient portal via website or via an app. But they still have to have patient portal. That's where I'm confused.
Are you saying they have to go through their patient portal to use the app?
It is their patient portal. It is an app for their patient portal, yes.
So are you asking if the patient has opted out of their patient portal,
right?
How do they still electronically access?
Exactly, because we don't publish to anything else other than the patient portal that is available to them.
Okay. So I think in that case, that would be a true opt-out patient, a patient that has fully opted out of electronically accessing their information. And as long as they've been provided all of the information to opt back in without additional information or additional action required on the provider's part,
right,
then they could be added to the numerator, assuming that they've also been provided all of the information about the API and authenticating their access.
Okay. Yeah. Because that all comes when we first invite them to the portal. Like, they have access through the website and the app immediately as soon as they activate it.
Okay.
But I was just really confused with that question 21, because you're saying you have to give them access to their data somehow electronically when they're opted out. Like, they said they didn't want electronic access, so how am I supposed to give them electronic access?
And
just
so in
really
that
confusing.
scenario, your API was not enabled during the period, like when you solve them. And so if they said, so for example, let's go first, is VDT and API is enabled when the patient came in. They said, I don't want access to that, either one. And you say, okay, great, that would be a true opt-out patient. However, there's a second scenario where the EP came in, your practice was only offering VDT access and not API. And so then API was turned on after the patient left. That patient doesn't have access to the patient portal because they said no to VDT. To make sure they're saying no to API, you have to reach back out to that patient via email maybe or a mailer and give them that information and say, here's the API, how you can access API if you want to. And you can say you can only access it through the patient portal to begin with.
Okay.
But you still have to reach back out to them that second time in the scenario to make sure they understand and they confirm with you that they're saying no to API.
Okay.
Does that make sense? Does that clarify it?
Yeah, it does. I was just, when you were reading through it, I was like, what does that mean?
It's a long answer and a lot of information, so I completely understand.
Okay, great. Thank you.
No problem.
Thank you so much, Priscilla. Also, for those on the line, the email address for your questions to be sent directly to Access is ehrIncentive-payments@access.gov. If folks are in the chat box, they'll be able to see that email address as well. Or you're welcome to direct your questions to healthcurrent@healthcurrent.org. We are a little bit over our time today. Priscilla, did you have any closing comments that you'd like to have for the folks on the phone today? Or are there any last-minute questions that we might be able to answer?
Just so everyone knows, I mean, again, all this information, all these documents are going to be made available from Access and Health Current, and any questions you'll have, feel free to reach out to them, and we'll make sure your questions get answered and help you to understand this objective as best as possible. Thank you all for joining today.
Wonderful. Thank you again, Priscilla. Thank you for the great questions today, and a copy of the presentation will be made available along with the recording of today's webinar. Thank you again, Priscilla, for presenting, and thank you for all participating. Have a wonderful rest of your day. Take care.
Have a great day. Bye.
Bye.
Bye. Bye.